Hi, welcome. My name is Rebecca. I am a pediatric nurse in the Youngstown State University RN to BSN program. Today I'm doing an educational presentation to my teenagers out there on the flu vaccine. My goal is to empower you to be able to make the right decision for you on whether or not to get the flu vaccine, that you have all the information to make that decision, and that you're comfortable asking questions when you're in with your healthcare providers and nurses. The flu vaccine saves thousands of lives every year, and I want you to understand why it's so important. I do have this handout that we're going to pass out here. Kind of lets you know of okay, so you're ready for graduation, but what about those flu vaccines and the other immunizations that you need as a teenager? So we're going to pass these out, but today we're going to just be specifically talking about the flu. As we learn about the flu vaccine, I'm going to ask some questions. That's just going to be interactive, just kind of shout out the answers. No quizzes, no grades. We're going to do this together. At the end, we are going to partner up. So we'll break everybody into pairs. We'll have one person will be the nurse, one person will be the student, and the nurse's job is going to be to take the information that I'm going to provide here in the next few minutes and teach it to the patient. And then the patient's job is to ask questions and clarify. And if questions arise that you're not aware of, I'm here as a resource. Chances are somebody else in the room has the same questions. So let's learn from each other. We're definitely going to make this interactive and fun. So as teenagers, you are all very well aware of the feeling of going to the doctor and getting those dreaded shots. You've been doing it since you were babies. So I really believe that teenagers have just as much, if not more, anxiety related to immunizations and vaccines than any other age group. So I want to talk for just a few minutes about how we can decrease that anxiety for you. And if we work together, we can definitely do that. It's really important that you're able to share with your providers and your nurses if you're anxious, because they can definitely take those extra steps to make sure that you're comfortable. Our goal is to protect you and keep you safe, and so help us do that. Give us the information that we need to do the right thing for you. Some of the things that I do, I offer to my patients is to lay down instead of sitting. Or if they have phones, watch a video. Distraction is great. Listen to music. Sometimes they'll talk to a friend or a sibling or a parent that's in the room to kind of distract them, and that does help. We also have this really cool stuff, Freezy spray. It's like this big, comes in a little can, looks like a little hairspray can. A couple squirts of that makes the skin cold, and as the skin's getting cold, it's actually numbing the skin. So you don't have that same feeling of that pinch of the needle as you would have without it. It's great. It's magical stuff. So share with me a few ideas that you've experienced or seen or work for you on how to decrease your anxieties related to injections or just doctor's offices in general. That's great. That's great. Those are wonderful ideas. And they're also ideas that I can take back to help my patients and my practice succeed even better at making our teenagers feel comfortable and safe to get their injections that they need. Just real quick, briefly, I want to touch on fainting. It is a thing, especially with teenagers, when it comes to getting an injection. If you have fainted, you feel faint, dizzy, or you're just anxious, just go ahead and let us know. You can ask to lay down while you get your injection, and then when you're done, when the injection's over, you can lay there for an additional 15 minutes or so, longer if needed, just until you're rested and you feel like you can sit up. And we want you to sit up slowly, sit there for a few minutes, and then stand. But trust me when I say we're here, we want to keep you healthy, safe, and comfortable. We're going to protect you if you did faint. We'll do that for you. So the flu immunization, also called the influenza vaccine, the flu shot, different names, all the same thing. The flu is a viral infection that is spread by droplets. So a contaminated person is coughing and sneezing, and all the droplets are leaving them. Those of us that are not contaminated will be if we breathe them in or they go in our nose or mouth. Very important, coughing in the elbow to keep the germs from spreading far. Don't cough or sneeze in your hand, because you can't even get to wash your hands somewhere without having to touch something. So do your best not to cough or sneeze in your hands. Also, when you're washing your hands, friction is huge. It's so much more important than the temperature of the water or what kind of soap you use. Like 15 seconds, sing the happy birthday song and scrub those hands will help to decrease any of the germs. They're really, washing your hands and protecting your coughs and sneezes is really vital to not passing on infections to others. So, why get the flu vaccine? Wait, before we even get there, let's ask a question. How many of you have heard the long time rumor, if you get the flu vaccine, you'll get the flu? It's a myth, and I'm here to prove it. We're going to talk about it. According to the CDC, which is also the Center for Disease and Prevention, the flu vaccine is the safest medical product in use today. Hundreds of millions of people have received the flu vaccine over the last 50 years, which means we have prevented the flu more than I could possibly try to count. And so it really is a safe product. It's changed every year to fit our needs for that year. So it is important that you get the flu vaccine every year. The strands that are meant to be prominent or expected to be prominent this year will be put into this year's vaccine. Next year, those strands may change. It is recommended that you get the vaccine usually in October or as soon as it's available to you. Of course, better late than never. Honestly, January comes around, people are still getting the flu. Get the flu vaccine if you haven't gotten it. Truly, better late than never. But October is the starting goal. Where can you get the flu vaccine? Yes, all good places. Yep. There's so many places out there that you can receive the flu vaccine because it is so important that you get it. And the community is really doing its best to make it affordable and convenient for everyone to get it. You can look for advertising signs in your doctor's offices, urgent cares, pharmacies, schools, and even the health department for places that you could get it. So, question, how often do you get the flu vaccine? Yes, yearly. What month can you try to get it in? Preferably October, but better late than never. And why do you have to get it every year? Yes, because the vaccine that's made for the flu is made every year for that particular flu season. Good job. So maybe you're thinking you still don't want the flu shot. You're not doing it. The little pinch isn't worth it. So here's just some facts that I think are worth reviewing to kind of influence so that you have enough information to make a good decision. Obviously, the flu shot can keep you from getting the flu. It's also, the flu is worse than the common cold. So if you're off school for a week, I know it sounds like fun, being off for a week, TV, video games, but it's not going to be fun. If you're coughing and sneezing and you have a sore throat and you have aches and pains in your muscles and your joints, it's going to be miserable. The exhaustion from the flu lasts days to weeks, so you're going to be missing more than just school. Activities, your friends' events, parties. You're going to be Snapchatting them from your bed because they're not going to want to come in your room to visit you. They're not bringing the party to you. So think about that. You want to protect yourself just so that you're not missing out on all the things that are out there. And you sure wouldn't want to end up in the hospital because your illness became great. But also think about the people that by not getting the flu vaccine that you are opening to infection or exposing to infection. If you get the flu, you can be exposing your grandparents, older adults, babies, children, people with chronic illnesses. Those people, those groups of people are particularly at risk for having a greater illness from the flu opposed to the healthy average teenager. So you might be able to bounce back from it a little easier than them. So when you're thinking about whether or not to get the flu shot, think about your loved ones and that you have the ability to protect them. I think that's really important. You have the power to protect them, and they're going to love you for it. Hospitalizations in children under the age of 5 range every year, starting in 2010, from 7,000 to 26,000 visits, hospital stays a year. It's a lot. And some of them could be prevented by getting the flu vaccine. Also, I want you to take a minute to realize that deaths do occur from the flu. Since 2004, we've had a minimum of 37 deaths in the year 2011 and 171 in the year 2012. So just keep that out there. The side effects are minimal. It's mostly going to be related to the injection site, swelling, soreness, redness, and then some folks have reported nausea, fatigue, and a headache, but very minimal compared to the benefits of the flu. So we're going to step now. I want to thank everybody for listening, And I hope that you can make good decisions, and let's break up into our groups. Thank you.